Hi, this is Sandy with Sunshine Home and Companion Care, and I am bringing you this Red Light Minute. Today I wanted to talk to you about something more serious. Today I wanted to talk to you about signs that your senior loved one needs help within the home. Now we know it's not everybody's desire to send their senior loved one to a nursing home or long care term facility. The goal is to keep them home as long as possible. That is our goal, and that is your goal. But sometimes we have to look for signs that our senior needs help. Sometimes as the loved one, we kind of don't see these things because there's a certain amount of denial that our loved ones are aging and are at a time where they might be needing a little bit of help. So to just be mindful of the things and their surroundings, and this should give you a clue if your senior loved one is in need of some type of assistance at home. Now, this isn't necessarily bad news. This is good news. We want you to be aware of all the things to look for, whether you're in denial or not, but to just be aware of the surroundings and to take note of what's going on, and then decide from there if help is actually needed. One of the first things that usually is a sign, there's many signs, but one of the first signs is bathing or lack thereof. If you notice that your senior loved one isn't taking care of their personal appearance, if they're not taking care of hygiene needs, brushing the hair, brushing the teeth, taking a bath, wearing deodorant, and all of these things, if you're starting to notice a difference in that, that might be something to keep an eye on. Another thing to look forward or look to is not only the dressing and grooming, but to look for their toileting. If they are starting to experience some incontinence, if they're having toileting issues, that's one thing to look for. Transferring and moving from a chair to a couch or to a bed to a table, a kitchen table. If they're having trouble transferring and getting about from place to place within their home, if they're having a little trouble with their stability in their walking, that's definitely something to look for, look at when you're observing your senior loved one and their surroundings. Look at their eating habits. If their eating habits have changed, whether for the more or for the less, I mean, that is something to be aware of. Take note of the inside of the refrigerator. If it's just a hodgepodge and a mess and, things aren't covered, or even worse yet, things have been in there for a very long time, and that's not typically something that they would have done. That's a clue that they may need some help. In the kitchen area, noticeable weight loss, noticeable weight gain, there's a sloppy appearance, a noticeable decline in their grooming is a big deal. Just take note of that. And sometimes I know, and I have experienced this in my own life, denial, and that's just something that we're just going to have to start opening our eyes and paying attention to. Are these things? Look for noticeable burns or cuts on their hands or arms or body. If they've harmed themselves and haven't mentioned it to you, or if they've harmed themselves in the kitchen, burned themselves, cut their hands, cut themselves shaving, but like seriously really cut themselves. These are the things that are common sense, but we just don't pay attention to it when we're not looking towards the future for our senior loved ones. So these are some of the things to look for: to a lack of drive and motivation. If your senior loved one has been very motivated before and very active before, but now all of a sudden seem a little disengaged, that's definitely something to look at. And maybe that might even be something to talk to your doctor about. But these are just signs. And I'm not giving medical advice. But what I'm saying is these are things to look for in your senior loved one, just to pay close attention to any changes. If they're starting to have trouble keeping track of time, if they know that they have appointments, but they're not ready when you are there to pick them up, or they are still driving but they don't get there in time, or if they're just keeping track of the time or the day. I mean, that is something to be concerned about. Failure to return phone calls and any attempts of communication. If they're not communicating with you like they were before and they seem to have withdrawn, I mean, that might be something that you need to address as well. And don't put it off as maybe they're tired or I've just been too busy. You know, pay attention to that. These are things that we need to look at. Increased agitation, just irritability. The house is getting dirty, the laundry's piling up. There's so much. I could go on, but I don't want this video to take too long. However, if there are changes that are obvious to you, let us know. We will come in and do a free consult. We will help you, and we will put a plan in place for you. So again, this is Sandy with Sunshine Home and Companion Care, and we are your personal and dependable in-home senior care. Have a wonderful day.